Welcome to Words That Matter, a modern day book club. I'm Lee Smith, the host. Today we have a really interesting show. Great guest. I spoke with them during the last show, and I've spoken to them since then over the Target. And really one of the most moving, an incredibly moving interview. That's Dr. Scott Atlas. And Dr. Atlas spoke with us last time about the sorts of things he saw fighting COVID, fighting against the public health bureaucracy, fighting inside the administration, fighting academia, fighting the media. He and I spoke since then, and I said I'd really like you to come on again, and especially if there's a particular book that you find relevant or interesting that sheds some light on what's happening in the current moment. And please, let's do it. Let's come on. And maybe you won't be surprised to hear that book he wanted to talk about is a book I always love talking about, right here, George Orwell. This is an old paperback edition. This may go back to my high school days. George Orwell's 1984. So we're going to be speaking about that today for the next half hour, along with Dr. Atlas's own book, and that is A Plague Upon Our House. Welcome, Dr. Atlas. Welcome, Scott. Thank you so much for being here with us today on Words That Matter.
Happy to be here.
Well, so you and I spoke a little bit about 1984, but mostly we've spoken about what you saw with the censorship regime that was attacking you at Stanford, that was attacking you when you were working at the White House. And the way you put it was extraordinarily moving and extraordinarily important. It wasn't just an idea about the free flow of information, right, or the right to speak, as important as vital as that is to our democracy. But when they were censoring you, when you were in the Trump administration, it meant death. Right? When they were censoring you, who had important, useful information to share with the public, censorship meant death. So I just wanted to start with that and get your thoughts on that, and then let's launch into 1984, or why that is 1984.
I think it's very complicated what was done. It wasn't simply a blockage of information. There were several things, and they're right out of the book 1984, frankly, that were both tactical as well as big issue things. For instance, the public was inundated with propaganda. And what do I mean by propaganda? I mean false information over and over again. And it was used effectively because the idea that there was a false consensus by virtue of censorship, for instance, added weight to the information that was being fed the public. And so the opposing views to the so-called narrative were viewed as a threat if they were actually heard. And as we know, censorship is not just blocking the speaker, it's blocking the listener. It's two sides of it. And so this is a very effectively used, not just reminiscent, frankly, of 1984, but if you want to really go out on a limb, it was reminiscent of my superficial knowledge of Nazi Germany, where a certain group of people were deemed dangerous and the enemy of the state, and they had to be eradicated. And as we saw, I think there was a lot of viciousness and hatred among regular people that stemmed from that effective use of propaganda.
Yeah, that's really fascinating. And of course, we do see that in 1984, where we have the idea of the 2 minutes of hate and then the week-long hate. But and you've said before that they were driving people against each other, that this is the legacy of Anthony Fauci, the legacy of Deborah Birx, that they helped divide the country. And that is a part of totalitarian regimes as well, devising, certainly with Nazi Germany, devising internal enemies and turning the weight of the state against internal enemies.
Absolutely. I think that, there are many legacies of what I will call the lockdowners. And by that, I mean particularly the public health leaders, Dr. Anthony Fauci, Dr. Deborah Birx, who advised to do the shutdowns, the lockdowns, the isolating of young, healthy people on the basis of a positive test. And in fact, not allowing them to go to college, they advised blocking their attendance if they didn't get the mandated vaccines, but that came after I was gone. Besides the heinous abuse of the public, besides the big fiasco where over 1 million Americans died from COVID and millions of people, particularly low-income families and children, were destroyed. And again, to bring it back to the topic of 1984, I think a big part of 1984 was that regular citizens were reporting other citizens for disobeying, for going against narrative, for speaking out. And we saw this in the United States. We saw it in Canada, frankly, also. We saw in a lot of what we thought were civilized free countries where neighbors were calling the police if, for instance, there were more than 4 people, more than 6 people in your home. And this kind of mob mentality, yes, it stemmed from the propaganda. Yes, it can be traced to the people in power. But it's also very concerning that Americans particularly were either so weak or so evil. One of the big shocks for me was how much evil there was.
You said that this makes you despondent somewhat for the future. You said that if they could get away with this, and if you're a fool if you believe that they won't try something like this or worse again, partly because of the leadership, but partly also because of the acquiescent population, what Americans failed to do, that Americans failed to stand up to this. Do you still think that's the case?
Yes, I mean, I think we can say that there's a tremendous deficit of courage in our country. There's a tremendous deficit of courage amongst our leaders that we have elected. Many of them hid behind the CDC as if they weren't making the decisions. Many of them were fearful, I feel personally. Most of them did not seek other views. They just listened, and they were very happy to do so, including using massive, really human rights violations, which are unconstitutional breakages of guaranteed freedoms in this country. We saw this over and over again. There were very few leaders who had the courage to even entertain the alternative views. There were very few leaders, and I advised some of them, including Governor DeSantis of Florida, Governor Kristi Noem of South Dakota, who decided after looking at the information and listening, they made the critical thinking that's necessary to know what's right from wrong, and to go against the so-called narrative and trust the people. So, we have a tremendous lack of courage in the United States, as I started to say, and I think this is very concerning. There were hundreds, if not thousands, of scientists all over the country that emailed me saying, "You're right, keep saying the truth. I'm afraid for my job and my family. I cannot step forward." And okay, I empathize with that, but at some point, no. At some point, you have to step forward. People were dying, number one, dying unnecessarily. Number two, we were not protecting the high-risk people with this lockdown strategy. I wanted to increase the protection of the high-risk people. Third, we were destroying poor people. This is grossly unethical. We were shifting by lockdowns the burden of the disease to the so-called essential workers crowd, which are the people working in the grocery stores, the people cleaning the toilets in the hospital, the people that are delivering for Amazon, while the affluent are sitting at home uninterrupted, for the most part, getting their full salary, working on their laptop. So this is unethical for public health guidance to shift the burden of a disease to poor people. And again, they got away with it to a great extent because of the very effective use of censorship of opposing views and demonization of opposing views, so that this sort of propaganda, where it marginalized anyone who spoke against the narrative, became very effective. And that is a tactic that was actually used very, very much so in 1984.
There's a specific question I wanted to ask you. You know, there's that, and this is kind of a theme running throughout 1984, where they're saying, "Oh no, we've always been at war with East Asia." Right. And of course, Winston Smith's job is basically to help revise history, right? He's going through the newspaper and he's changing history to fit the needs of the present. So one of the things I wanted to ask you, I just went back and did a little research, and I know you'll know about this, so I'm curious. But the assumption with the Fauci and Birx crew was that COVID could be transmitted by asymptomatic carriers. And just the little bit of research I've done, it appears that there's long been a debate in virology and other medical fields like, well, yeah, maybe it's carried, maybe influenza or other respiratory illnesses are passed through asymptomatic carriers. But with COVID, it appears that no, 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 absolutely. This is the most dangerous carriers of all, the asymptomatic carriers. So we need to keep testing them. We need to keep them in masks, and we need to keep lockdowns, right? So, I don't want to get too specialized, but what was the story behind the asymptomatic carrier issue? Was that the case that we've always
Well,
believed in asymptomatic carriers? We've always been at war with East Asia.
that has many parts to the answer. First of all, the known pandemic management for more than a decade, which was articulated in a review paper in 2006 by Henderson, was that lockdowns don't work to stop the spread of viral respiratory infections, and lockdowns are extremely harmful. That was known. So they broke the standard knowledge just by saying that we should do lockdowns. The second thing was, on a broad topic, that many things were simply refuted, basic knowledge that we had. For instance, that when you recover from a viral infection, you have long-term biological protection. That's basic immunology. That's not PhD level immunology. That has nothing to do with epidemiology, by the way. That's not medical school virology or immunology. That's high school level biology. That's if you have a son or daughter taking AP biology in high school, you could ask them that question. And yet that so-called natural immunity, which is protection against the severe disease, was denied to exist with this virus for some reason. We've known it for thousands of years, Frank. Now, Fauci even said early on, quote, asymptomatic carriers are never the driver of pandemics, unquote, are spread from people coughing and sneezing and having symptoms. And this is just also common sense, but it happens to be biological fact on respiratory infections. And so the general recommendation, if you're sick, you stay home because the sick people are the ones infecting people. But as your statement is implying about influenza, we don't go and test everyone for influenza. And if you test positive or asymptomatic, you must stay home from work. You cannot go to school. I mean, this is absurd. And yet now it is standard. And so, we at this point, by the way, there should be no testing for COVID being done. It's completely irrational. We have an endemic virus. It's not a virus that's pandemic. It's not a highly lethal virus. It will be here forever. That's what endemic means in low levels. And so you don't keep testing for endemic viruses. I mean, this is sad, and it's sad that it's recommended or done, but it's also sad that there are many damaged people out there from, again, the propaganda. I hate to use the term, but it's truly misinformation. Most of the things that Fauci said and Birx said, and that the so-called experts from universities like Stanford, where I work, and elsewhere, they were spouting nonsense, misinformation, contrary to biological fact. And now we really are in the phase that you alluded to in 1984 of rewriting history even more explicitly. We weren't just rewriting biological constructs that we've known for decades, hundreds of years, thousands of years. We are now rewriting history. We're watching it because we're hearing the lockdowners say two things. They're saying, A, they never said to close the schools. They never said to lock down, which of course is preposterous and just a bald-faced lie. And the second part of rewriting history is that the people who are to blame are the people that were opposed to what was done, rather than the people who wanted what was done, because what was done was the lockdowns. So they own the record here. The lockdowners got what they wanted. The lockdowns were implemented. They own the results. And so, in a tangent off of this, I wanted to say this, which is that the people who prop up and praise Fauci and Birx for their guidance are praising President Trump's administration, because that was the official White House guidance of the executive branch, the White House task force. They wrote all of the guidance to all the governors. They visited, particularly Birx, all of the public health officials. That was the official guidance. If you want to criticize the Trump administration's guidance, you are criticizing Anthony Fauci and Deborah Birx, because that was the guidance. There is no space.
Do people want to
between those
blame
two.
you now? Have you found that people are turning this around and blaming you?
Well, what we see is that in places like, okay, the lockdowners, the people who are responsible for what was done, particularly Deborah Birx, who was the White House coronavirus task force head, and then Anthony Fauci, who was the most visible face and then stayed on as the official coordinator or advisor to the president when President Biden took over. Birx has said many times that, people like me personally are to blame because we were opposed to the lockdowns. Well, but the lockdowns were implemented. That makes no sense. And I also hear them saying they never advised the various lockdowns and mandates that were actually implemented due to their advice. So, we're seeing a lot of a very shocking denial of fact and a very sad run from responsibility and accountability. And we cannot have that. We cannot allow that to happen. We need the facts in an objective and diverse society. We also need accountability, because if we don't make these people accountable, it will happen again. There's no question in my mind. And so even now, though, we see some of the continuation of this nonsense. We see Fauci and many other places, including major hospitals, start mandating masks. Okay, masks do not work. Surgical masks do not protect the wearer, and they do not protect from spread. This was known from May 2020 in the studies published by the CDC. And yet it was repeatedly studied during the COVID pandemic and proven, and all the data, all the good data was reviewed, and all of that showed that statement that masks do not work. Yet we still see in Palo Alto, where I live, many people walking around wearing masks. I feel like it's now to the point where these people are dangerously irrational. You would not want people to be in charge of anything or in any responsible position who believe that masks work for COVID. These people are flat earthers.
And these are our
today's flat
elites
earthers.
for the most part. These are our elites spread out throughout the country, mostly through blue areas.
Yes, they have.
Scott Atlas will be back in 1 second. For those of you watching on YouTube, we're cutting away. Please make the jump to Epoch TV exclusively, having a really important conversation here with Dr. Scott Atlas, how COVID appears to have injected the reality of 1984 into American society, perhaps around the world. So please make the jump with us to Epoch TV exclusively. We'll see you in less than a minute.
Thucydides is along with Herodotus, one of the fathers of history, and he's explaining what happened at this pivotal moment when Athens forfeited its democracy.
Thucydides is kind of the foundation, because he tells us how to tell ourselves a story that has a tremendous amount of complexity. But we're living in such a time of emotional, of intellectual, of academic, of societal disequilibrium and distortions. We have to learn how to tell ourselves this story.
What is the most important thing that Thucydides can help us understand about our present moment?
The mind is not perfect, but it can perfectly hold about 6 or 7 thoughts in its frontal lobe at a time. So the media is really trying to influence what thoughts those are and whose ownership those thoughts are. They would like to have complete ownership of those thoughts. So they are constantly bombarding our frontal lobe with what they want us to think about. Thucydides has to be understood so that we can tell ourselves this story. We can't rely on others to tell us this story.